The CDC is reporting an alarming increase in syphilis cases among newborn babies here in the U.S. The CDC report says there were more than 3,700 babies born with syphilis in 2022, more than 10 times the number reported back in 2012.
The CDC is urging increased screenings and treatments to reduce the incidence of syphilis among newborns. Joining us now to shed some additional light is Dr. Juan Salazar from Connecticut Children's. Thanks for joining us. First, a lot of people are going to be shocked at this report, right? Like we were. How can this be happening?
Yes, Sarah, this is amazing that in this day and age, we have 3,700 cases of congenital syphilis in the U.S. That's just simply not acceptable. Here in Connecticut, fortunately, we're doing a little bit better, but we did have 2 cases of congenital syphilis this year, and we had 20 cases between 2018 and 2022. This is completely preventable. If moms are diagnosed during pregnancy, they can be treated with penicillin, and you can completely avoid congenital syphilis. So this is a shock to many of us. This is a disease that's transmitted sexually, and anything that's transmitted sexually is very difficult to control, which is what we're seeing in women in the U.S. now. So we can actually prevent this. We need to diagnose the disease in women as soon as possible, treat them appropriately, and then prevent the transmission of this bacteria to the baby, which can be quite deleterious to the babies.
Well, Dr. Salazar, let me drill a little bit deeper on a couple of things you just touched on there. First of all, where is congenital syphilis the most prevalent, and have the rates soared the same way here in Connecticut?
Well, this is a disease that is quite prevalent throughout the world. And believe it or not, Brent, there are approximately 250,000 children that are born with congenital syphilis throughout the world, and many of them die either in utero or soon after birth. This is a disease that we have not controlled by, having a proper treatment. Now, here in the U.S., for many years, we were on the right track. We were controlling syphilis in the general population, that's venereal syphilis in men and women. But unfortunately, over the last 10 years, we have seen a resurgence in syphilis in men, many men who have sex with men, but also women. And we have seen an increase in the rates of syphilis in women. Once you have women of childbearing age with syphilis, venereal syphilis, then obviously there's a higher chance of transmitting that to the babies. So we need to do something about this, and we can certainly do it by preventing the disease in the first place, and there are many ways to do that. And secondly, by treating the moms appropriately when we diagnose them. We have to diagnose them in the first trimester, in the second trimester, give them the penicillin when they need it.
Are you saying that then pregnant mothers then are maybe not seeking that treatment, not seeking those diagnoses, and when they're pregnant? Is that what's happening here?
What needs to happen under normal newborn care is moms need to have a syphilis test in the first trimester of pregnancy. As soon as they're diagnosed with they have a pregnancy diagnosis, then they should have a test for syphilis. If the test is positive, they need to be treated immediately. But that's not enough. You have to have a repeat test in the last trimester of pregnancy, because women can get infected during their pregnancy. And if at the last trimester of pregnancy, women are tested, they're positive, they can be treated appropriately, and then you can prevent transmission to the mother, from the mother to the infant. Now, that's not enough either. If a mom is diagnosed with syphilis, we obviously need to also diagnose their partner effectively, so we can actually provide treatment to the partner. If we do both of those things, then we can actually prevent the disease from being transmitted.
All right. Thank you, Dr. Juan Salazar from Connecticut Children's. Thanks for joining us tonight.
Thank you.